So number 6, and this is a big one that definitely are going to have concerns over, is what to do if I have lost or broken my retainer. So usually this is something that, yes, we want to get you into the office as soon as possible to take care of assessing if there's been any movement and what we can do in regards to providing you with a new retainer. However, during this time of our office closure, this would not constitute an emergency to be seen in the office. So what I'm going to ask you to do, the first would be originally, when those braces came off, you were provided 2 sets of retainers. You were provided the clear retainers to wear during the day and the wire retainers to wear at night. This is the time to go back to that other set of retainers that maybe you haven't worn in a while and see if they will still fit. They might, especially with the clear retainers, they might be slightly tight due to the amount of time you may have been not wearing your clear retainers anymore. But if they still do go on over the teeth and you can get, like nighttime wear out of them, they will hold your teeth until we can see you again to make that set of retainers that are broken, and vice versa. If you have your wire retainers and you lost or broke your clear retainers, then you need to wear your wire retainers 24/7 if you're supposed to be in full-time wear. Nighttime wear, again, continue the 12 hours. So that is super important if you still have the other set of retainers at home to rely on those. The second option that we would have is if your model was intact during the retainer fabrication and we provided you with that model, we will be able to set up a time where you could drop that off outside of the office, and then we would be able to make a new retainer off of that model. And then what we would do is provide you with a clear style retainer that I would be able to trim and then do an outside office pickup or mail to you. So if you have that old model at home, we would definitely need to make sure that it's still intact and we could make a retainer off of that. If you don't have your old model at home, or maybe it's been a little bit of time, it's already been a couple weeks since you've lost or broken your retainer, and you're just now thinking about getting it scheduled, or now you've started to notice some movement of your teeth because it has been some time without those retainers. Unfortunately, those are situations in which we do have to assess what's going on, which means we do need to bring you into the office when we reopen to see how much movement has occurred, maybe why the other retainers that you still have didn't fit, or if it's been a amount of time without a retainer, what we need to do for realignment. We do know this is going to cause some anxiety with patients in regards to having movement with their teeth during the time that we are closed. We will be very gracious in addressing that movement and how to get your teeth realigned and get the teeth back to where they need to be. But again, we will have to wait until the office opens to address those concerns. Thank you.